This video is to review the on-site inspection. The on-site inspection consists of 7 different parts: front office, office layout, back office, x-rays, sterilization room, crash cart, and records. In order to pass the on-site inspection, a score of 90% or higher is necessary. 89% or less is not passing. The self-inspection should be completed every month between the 1st through the 15th. The front office inspection consists of 5 items. The first is the prescription sign posted in the front office. This includes the personnel authorized to call in prescriptions. Next is the emergency numbers posted in the front office. Make sure the names or numbers have not changed. Next is our tamper-resistant paper. Make sure it is available and secured in a lockbox. Next is our X-ray RDA certifications up to date. All RDA certificates should be posted on the wall and not expired. Check expiration dates on certificates. The same applies to our doctor's registrations. The office layout portion of the on-site inspection consists of 7 items, the first being food and drinks cleared throughout the office. No food or drinks are allowed in the practice besides the break room. Verify there isn't food or drinks throughout the office besides the break room. Electric outlets covered. Electric outlets need to be covered if they are within a child's reach. Check the lobby and in low places. Check and replace outlet covers daily. If 1 or 2 are missing, do not deduct from inspection. Exits open and free of blockage. Exits must be free of obstructions such as boxes, ladders, and cylinder carts. Check all exits are free of obstruction. The fire extinguisher must be checked once a month and documented on the fire extinguisher tab. Check the paper tag on the fire extinguisher. The back of the tag has 12 rectangles for each month to document initials and the date of when it was inspected. Check the dial is in the green or in full, the tubes in good condition, and the clip with the year isn't broken. Protected health information must not be visible to other patients. Check counters, wall holders, and computers to ensure PHI is not visible to others. Ensure all electrical panels are cleared. The electric panels need to be clear of at least 3 feet. The cleanliness of the office layout is important. Go through each room and every operatory to ensure it is cleaned. Look for trash and dirt. Be sure to clean areas such as the dental chairs, the base of the dental chairs, the counter, dental tubing, the dental arm, dental light, computer monitor, behind the computer monitor, trash cans, paper towel dispensers, cabinets, containers in rooms, and the TVs on the ceiling. The back office portion of the on-site inspection is the largest. It begins with the server. The server contains data from all computers in the practice. Verify that the server is always logged at the end of the day. Nitrous, oxygen, and helium tanks need to be secured in a cart or chained to the wall. The cap should be placed back on them. Check the full and empty tanks are secured. Check that the eyewash station is in good condition. If storage space below the eyewash station is needed, items need to be contained and nicely organized. If the office has ample storage space, then cabinets below the eyewash station must be cleaned and empty. Contact facilities if your eyewash station has rust or needs to be replaced. Check that the eyewash station is clean and has protective sprouts. Turn on the water to verify that it works. The biohazard trash needs to be hands-free with the lid and have a biohazard sticker. The lid needs to function properly. Ensure trash is in the right can. Treatment rooms need to be cleaned and disinfected. Check every operatory to avoid cross-contamination. Cross-contamination is prevented by cleaning and disinfecting after each patient, sterilizing every handpiece after each patient, using closed containers for dirty instruments, etc. Verify all of the items are compliant. All supply carts must have a cover or be covered to prevent cross-contamination. Check supply carts have covers. Ensure that supply carts are not in rooms during treatment. Offices that do not have washer and dryer should wear disposable PPE. If your office has a washer and dryer, all soiled coats and scrubs should be washed at the practice. Check this is compliant. The assistants need to wear gloves, masks, goggles, and a coat at appropriate times during x-rays, treating a patient, handling biohazard, etc. Go through the practice and verify all assistants have the appropriate PPE on. The x-ray portion of the on-site inspection is as follows. The first log in the checklist binder is the operator's acknowledgement, safety guidelines, and procedure. All employees must be trained prior to taking x-rays. The training material is located on the homepage. The new employee will read through the radiology manual and will be trained on it. Then they will sign this paper. The x-ray tech or employee assigned to verify x-ray certificates will confirm all assistants are eligible to take x-rays. Verify the registration on the wall are not expired and verify employees taking x-rays within their first year of dental assisting are compliant. Fill out the log accordingly. Inventory of equipment. Verify all radiation machines are on the inventory list. Only list radiation machines. Do not list batteries or sensors. This list will last for a year, then needs to be updated again. Check to make sure the list does not need to be updated and is still current. The lead apron evaluation in the manual should be checked monthly and current. Check the lead aprons for any holes, tears, or rips. Lead aprons should be disposed of if damaged. Contact the City Waste Department for instructions on how to dispose. In the meantime, place a lead apron in a hidden secured area with a Do Not Use sign. The sensors need to be tested monthly with a step wedge. The test should be printed and placed in the radiology manual. This test should be labeled by sensor and serial number. The phantom test should also be completed on your panel machine monthly. During this test, only 5 needles should be visible. If your office has more than one panel machine, then you should include a serial number. The assistant should use a mechanical device on every patient. They should not hold the sensor with their finger. Clorox hydrogen peroxide wipes are the only wipes allowed to clean and disinfect radiation equipment. Ensure Clorox hydrogen peroxide wipes are being used. All nomads need a shield to prevent radiation exposure to employees. The shield is clear, circular, and attaches to the nomad. Check your staff is using the nomad with the shield. The sterilization room portion of the on-site inspection consists of autoclave maintenance, SSCs being sterilized, clean instruments, and sharps containers. The autoclave should be current with maintenance. Check the autoclave from the outside to inside. Verify the gasket is in good working condition. Verify the water level is in the high green. Remove the instrument trays to check for debris. Check that SSCs are always sterilized. They need to be sterilized when newly received and prior to patient use. The cleaned and sterilized instruments should be organized in bins or in drawers. Spot check the pouched instruments for tears, dirt, blood, or prophy paste. Check that composite guns are being sterilized after every patient and not cleaned and disinfected with a wipe. Every operatory and sterilization room should have a sharps container. Every sharps container has a black line on the front of the container that says "Do not fill above this line." Verify objects are not past the line. The crash cart portion of the on-site inspection consists of oxygen tank and crash cart, emergency kit with meds, AED software, ambu bag, sedation cart, sedation log, and drug reconciliation. If your practice does sedation, then your practice will have a sedation cart, and it's mandatory to have an emergency oxygen tank. Check your emergency oxygen tank by turning it on. The dial needs to be in the green or near full if it's not color indicated. The sedation cart will also include your AED, emergency kit with meds, and ambu bag. The sedation cart needs to be organized in case of emergency so that all items are easily accessible. Check the emergency kit to make sure it does not have expired meds. Check the medication's expiration date. If your office has multiple sedation boards, your office may not have an emergency kit. The AED should be next to the emergency kit. Check that it turns on. Also check the AED pad's expiration dates. You should have pads for adult and pedo.
Battery, okay. Powering off.
The ambu bag should be next to the AED and emergency kit. You should have an ambu bag for pedo and adult. Check the tubes to make sure they're in good condition. Anytime sedation medications are given to a patient, they should be logged on the end of day sedation logs. The practice manager will check the sedation log at the end of the week. Both employees should also check for discrepancies. The final portion of the on-site inspection is the records portion. The safety policy checklist needs to be current for the annual year. It's located in the safety policy binder. Check the safety policy checklist is current. The SDS binder should be updated with new chemicals, and the chemical list should be updated as well. A copy of the safety data sheets are located on the homepage. In the red binder, you'll find the fire prevention policy checklist. It needs to be current for the annual year. You'll also find your biotrash receipts. Check that all biotrash receipts are kept in the binder and organized from newest to oldest. In your maintenance binder, you'll find a copy of the eyewash station inspection, your autoclave spore test, your autoclave maintenance logs, and your NewPro Freedom log. Make sure all these logs are current and organized from newest to oldest.